All right, everybody. Welcome, welcome, welcome. Thanks for joining us. This is Dr. Tom Moorcroft, and I am really pumped tonight. We are hanging out for a special Lyme Awareness Month event with my buddy, Dr. Miles Nichols. And so, Miles, just thanks for joining us tonight and taking the time out of your busy schedule to, help educate everybody.
Of course, happy to be here, and thanks for putting something together for Lyme Awareness Month. It's important to bring more awareness to this very important infectious disease.
Yeah. And, that's how you and I really kind of got to know each other and stuff was through Lyme. And so before we kind of dive into some of this stuff, and just so people know, one of the things that I really wanted to talk about tonight was, some of the stuff that we should be looking out for, maybe a little bit of early signs, a little bit of prevention stuff, and then really dive into what we're doing with sort of persistent disease. And I think what I really wanted to bring everyone's awareness to is that, like, you and I do things so differently, and at the same time very similarly. We come at it from different perspectives, and I think it's really interesting that despite the fact that, like, I look at it differently than you may, so many other people are just like, we kind of are, it's almost the same thing, but I think I learn a lot from hearing your background and where you come from. So I'd love for you to share maybe a little bit of who you are, where you come from, and sort of like your medical education, so people can understand sort of where we overlap and then where we're kind of doing things differently and learning from each other.
Sure, yeah. Yeah. So my background is in Chinese medicine and also psychology and mindfulness and somatic psychology in particular. And then having gone through Chinese medicine education, I use a lot of Chinese herbalism together with functional medicine labs and supplements. And I'm as part of a clinic and a care team that includes also pharmaceuticals and medications, but we definitely emphasize herbals very strongly because I do have that as a big part of my background and education. We also do things like peptides, which I know you do as well. So yeah, looking at a whole, use as many tools as possible in this particular condition, because as you know, people don't respond often to the first round of whatever we try. So we have to have lots of different approaches for different people and work on an individual basis and not just treating people as a disease. People need to be treated really as individuals, especially in relation to Lyme.
Yeah. Well, I find it so intriguing that, like, you're like, hey, this is my background, and wait, peptides. And yeah, it's like, I think the things that work, right?
Yeah, absolutely.
So,
and mind body stuff too, and breath work and things that are meditation practices, mindfulness practices, gratitude practices. I think the brain retraining piece is becoming a lot more apparent of the importance of that as systems like DNRS are becoming more popular, and Gupta, and these things that people are realizing, oh wow, I can actually come at it from the physiological and from these practices perspective as well, and combining both work really well together.
Yeah, and I think that it's so key that despite coming at this from some completely different, apparently different backgrounds, and like most of our traditions actually mirror each other quite a bit, but yeah, is that, like, we're already, like, within the first, like, 2 minutes of talking, or maybe 3, we're talking about, hey, the mindfulness, the breath work, all the stuff that brings us back into our body. So one of the things that I would really hoping to talk about before, this is kind of like where I really want our conversation to go. But when we start off tonight, because it is Lyme Awareness Month, like, what are you seeing, and, like, what are you telling people to one, maybe look out for maybe early Lyme, especially, May, June, and then are you doing any, recommending any particular, preventive approaches?
Yeah, there's the obvious, if you see a tick attachment, like, send that tick in, get it tested, see what's going on there. If you get a rash, of course, that's important, but you don't have to always get a rash, and you may or may not get chills and flu-like symptoms. And if some things can take a while to even onset, and if you have weird symptoms, there's Lyme awareness of we're coming to a season, and that's important to understand some of the basics around the season. And then there's Lyme awareness from what are these kind of weird symptoms that people walk around with? Maybe they're shrugging off as I'm getting a little older, I have aches and pains, but they're moving pains and they're coming and they're going. Well, that's one of the telltale signs that it might be worth looking a little deeper. If you're getting stiff neck, if you're getting pains that are coming and going, moving around, if you're feeling fatigue that doesn't seem to necessarily be connected with lack of sleep or obvious reasons, if you're starting to feel cognitive issues that are unusual to you and they aren't connected with a direct trauma, then if you're feeling like you can't handle stress in the same way, these are also things that I think there's a lack of awareness around in relation to whether to start to look deeper into something like Lyme as being a potential part of a root cause in those cases.
Yeah, I mean, I think that like the way I was trained is, hey, you look at, you know, look for the rash, look for the swollen knee, those acute joint pain and, maybe flu-like symptoms, and like summer flu and all this. And those are all legit, right? I mean, those are real. You don't want to miss those, but like you really highlighted, I mean, it really goes beyond that piece. And that's like so important to me is that even in an acute presentation, it doesn't just have to be like quote unquote classic Lyme. And so the more we're aware of that, the better it is. And I think you really hit on something important where we're talking about migratory joint pain or some variation on that. And that's when we look at the evidence-based validated questionnaires, migratory joint pain is in very few things. Yep. And your doctor will usually know what migratory joint pain is in, except maybe Lyme disease, right? and it's like, unless it's like, gonococcal arthritis, or a few other small things, which can be pretty easily ruled out. You really have to be looking at it and say, hey, migratory joint pain, Lyme is high on my radar. And same with numbness and tingling. When we talk about Lyme and Bartonella, like migratory numbness and tingling is pretty much seen in nothing except one of those or their cousins. So certainly something to be aware of. Now, I spent a lot of time in Connecticut, a lot of time in Utah, completely different places. You're hanging out in Colorado. Are you seeing people with, sort of acute Lyme in your area, or is it more like the transplants from the coasts or the upper Midwest?
I see a lot of people with chronic Lyme that's probably been around a really long time. Where they got it remains often a mystery, but sometimes they do know that they got it. And it's sometimes here, it's sometimes other places. And there's not certainly the same abundance of ticks here, but people will be out hiking, there will be ticks. And although people aren't as aware of Lyme as a potential issue, there's Rocky Mountain spotted fever, there's some things that people, including the hospitals and primary care physicians, are very aware of here, but Lyme is not, unfortunately, one of those things that people are as aware of here. So it does go undiagnosed a lot. And so there can be, I think, a lot of people who wind up getting it, who knows where in their history. Is it even from mom? Is it placental transfer? I mean, there's lots of outstanding questions about where it could come from and when a person might have gotten it.
Yeah. So, and I think that it's so important. So much of what we see is chronic Lyme. And one of my missions is to minimize that risk, and bring it down. Like we want to alleviate chronic Lyme in people. Well, one of the best ways is prevention. And for sort of this month, one of the tips I always love to share with people is that there were studies done. I mean, this is like 20 plus years ago. Like if you take permethrin, which is, you can spray it on your clothes. If it's wet, don't be dumping wet permethrin into like streams and stuff. It's very toxic to aquatic plant life. But when you get permethrin and it dries, non-toxic to us, non-toxic to the environment. And if you put it just on your shoes and your socks, you can have a 70% decrease in the number of tick bites you get. And I mean, nothing else, just literally spraying your shoes and your socks that you wear outside and letting it dry, then wearing them. So there's so many things out there that you could do, but this is one of the most important things I think from a prevention perspective.
Yeah,
If you,
I keep that around, even though we don't have as many here. I still keep that around, and it's great to bring on travel trips as well. So
yeah, and there was a question in the chat I want to hit real quick. Also, migratory muscle and generalized pain in Lyme. Yeah, we definitely see that. I mean, is that something that you're seeing as well, Miles? I mean,
yeah, and whenever someone comes in with the diagnosis of fibromyalgia, I'm suspicious, of Lyme and or mold, or there are a few other things too. But if someone comes in with general that pain that's very nonspecific, and often that winds up getting the fibromyalgia diagnosis, then I very frequently see that we do find Lyme and or other infections, systemic infections, playing a role in that.
yeah. Yeah, and it's interesting because having been someone who experienced like the generalized fibromyalgia of everywhere and migratory pain at the same time, sounds a little bit ridiculous, but you're like, but this is the thing, you go to the doctor and you're like, what? They're, they look at you like you have 7 heads. And I'm like, well, yeah, like everything hurts. I can't, but this thing and that thing hurt. But then, oh, by the way, it was there, but now it's over here. And then, and so these are things that our patients are seeing that really are, negatively impacting us.
Yeah, or even just aches and pains. If someone just says, I have a lot of aches and pains. Sometimes people just use that language to describe that migratory pain too.
Yeah. So are there things that you're telling people other than permethrin in terms of prevention, or are there other habits you want them to have? I mean, granted, because I'm sure it's not just like people from Colorado see you, and it's not like all my patients are Connecticans or whatever we're supposed to call each other. We're seeing people from all around. So what are you telling people in addition to permethrin?
Yeah, well, I'm really telling people that the stronger the immune system is, the more they take care of themselves in general, the less inflammation they're walking around with, the more they're able to pay attention to stress and diet and lifestyle and practices, not just for trying to get over something, but actually for prevention. I wish more people would come see me, and I'm sure you do too, for optimization of function rather than just for getting over something, because the body, it's already so resilient. I mean, we're already dealing, usually most of us, with a lot of toxin exposures and sometimes multiple infections and other things, and handling it okay. And then something can push us over the edge, and then people can start to experience symptoms. But I think that if people can be proactive in focusing on trying to do even just some comprehensive labs to see, is there any underlying source of inflammation, underlying source of immune dysregulation, underlying source of gut dysfunction. If we can sort the gut out and do some basic work on inflammation and do some work on diet and lifestyle practices, then that's an amazing prevention, because the stronger your system is, the more likely it can deal with more infection and be okay. The immune system can fight off a lot.
Yeah, I think that's like so key, because when I'm looking at my prevention practices, it's like we usually miss the window, right? And then when I look at what are the things that heal people from chronic Lyme disease, the same things that allow their immune system to be strong enough to fight it off in the first place. So, and then everybody's like, what's your best brain detoxification tool? I'm like, sleep.
Yep.
I mean, it's like all the stuff you need to do is so, like, to be super healthy is so unsexy. So when you're talking about what are some things that people can do? So we're talking about prevention, and it's funny because like every article I read, tick checks and, put your clothes in the hot dryer and the permethrin. But what you hit on the nail right on the head is so important. So if you were to give people maybe a couple of tips that they could start working on at home right now, that realistically, like I just said, it's going to help you have an optimally functioning immune system so that it works better now to help you, if you're not sick, to prevent getting sick or really sick if you get sick, and can help you recover at the same time.
Yeah, I mean, I really encourage people to take an honest self-assessment. And that means that,
Wait, hold on. An honest self-assessment? Not just,
yeah,
I'm kidding, but
take an honest self-assessment. Like, you probably, if you're drinking a little too much alcohol, you probably know you're doing that. You're probably justifying, you have your reasons. It's, maybe it's helping you cope and manage with certain things. But if you know that about yourself, and you're willing to take an honest self-assessment, and you're willing to actually acknowledge that to yourself, and then take some steps, and maybe you're acknowledging something's wrong, something you're doing that isn't good for you, that you're unwilling to do something about right now. And that's okay to be unwilling to do something about that. But if you can take that honest self-assessment, you can start to find a few areas maybe that you do recognize that you're doing things that you know that you probably shouldn't be, and that you're willing to make a change there. And so maybe you're working a little too much, your schedule is too busy, and maybe you're willing to set aside a few days or half days to just relax and do nothing, and have put no agenda on the calendar. You can write the calendar thing with, like, the title is no agenda, right? You're just free time. Like, can you build free time into your calendar if you know you're too busy and that's part of what's getting in your way? Or if you're not getting enough sleep because you're watching too much TV late at night, can you commit to 2 hours before sleep not watching TV, even one night a week, or whatever it is? Can you take a small step? Can you build a small habit towards doing something that, in your honest self-assessment, you've realized that might be getting in the way of you getting the sleep that you need, the diet that you need, maybe a substance or something that's inflammatory that you're doing a little more of than would be optimal for you. And so I think an honest self-assessment can go a long way if people are willing to really take a look at the things that they know that they could be doing differently, and then pick one or two or three of them that they are willing to commit to take an action step on.
Yeah, I think you hit the nail right on the head. I mean, and it's like, I feel like if I, at the beginning of the current viral experience that we're all going through, because I know that, like, if I use words here and I actually tell truth, they might just rip all this down for other people won't get to see it, unfortunately. But the truth is, like, at the beginning, I said exactly what you just said. And it's like, and I think the most important thing is, whether you have a chronic illness or you want to optimize longevity, or you're somewhere in the middle and you just want to live like a greater life and be able to recover better, it's take a look at some of these things that Miles outlined and just pick one, right? So, for me, I break it down to sleep, food, movement, mood, mindset, and heart set. And, when I look at all these, I'm just like, hey, pick one. Pick one thing, like pick a breathing exercise, pick cutting out the booze, pick turning off the TV a whole 30 minutes before bed. You don't have to do a lot. Get some momentum behind it, right? And it's like, because the thing is, this is how you create a new habit. And I would rather you have this habit of taking care of yourself. And like you said, Miles, being so honest with yourself about where you're at. And don't beat yourself up for it if you're not at that place you want to be, right? Just go, cool, man. This is where Tom's at today. And I overbooked myself, or I overcommitted, or maybe I undercommitted when I was calling it a break. It goes all these different ways. But give yourself the freedom to just say, hey, this is where it's at. And I'm going to take this one thing and take action on it, because then you gain the momentum. And that one thing changes your immune system so much.
Yeah, there's a whole school of thought and a couple of books around. One's called Tiny Habits, one's called Atomic Habits. The idea is you build up these small habits, what they call habit stack. You build up all these small habits that it doesn't have to be or seem really big or monumentous with each habit, but you start to build 10, 20, 30, 40, 50 of those together. And now you really build some momentum. And if you're really taking care of, you build a sleep hygiene habit, and build a light exposure during the day habit, and build a meditation habit, and build a breath work habit. And each of these in and of themselves, it doesn't take that much effort to build one of them. But if you build one at a time and keep stacking new ones on top, then your whole life can become this tapestry of just an amazing experience where you're really integrating a lot of it. And some of them will fall off, and you can definitely do it without a lot of judgment and self-criticism, although that is one thing that you want to be honest in your self-assessment about too, is, are you really self-critical. And if you are, maybe you want to lighten up a little bit on trying to create too many habits too quickly. And maybe the habit that you want to create is more of a gratitude habit around yourself for who you are, and a self-care, self-love habit. Maybe that's the thing for you right now.
Yeah. And it's like that being the honesty. It's like, sometimes it feels like to me, it almost feels like it hurts when I really got into this stuff. And that's like, when you're being really honest, you're getting, and you're feeling it, but it feels kind of good, but kind of like hurts a little bit. Like, you're moving in that right direction. And, I tell people all the time, Miles, like, the number one cause of inflammation in the developed world is stress.
Yeah.
And that can be stress from microorganisms. That can be stress from relationships. That can be stress from beating yourself up and not taking a deep breath and giving yourself, a little bit of space. So when we're talking about all of this, because what I find so intriguing, and I really want everyone to hear this, is we're telling you that the same thing that we're telling our biohacking longevity people and our Lyme disease prevention people is the exact same thing that we are telling all the people that have chronic Lyme or chronic Lyme and Bartonella or mold illness, because these are the things that it reignite your self-healing mechanism. So yeah.
Yeah. The body has enormous capacity to maintain balance, but the unfortunate part of that is once it's out of balance, it can maintain out of balance too. This homeostatic mechanism is very powerful, and everyone has what we call an allostatic load. You're going to have stress, and stress isn't bad. It's just that the load can build so high that it can overcome the body's capacity to maintain that balance. And when there are stresses, and especially when those stresses are perceived, because there's the stress and then there's how the stress is perceived. And that makes a big difference in how the body physiologically responds to a stress. There's a study where they had the same stress and two groups that perceived it differently. And they were looking at secretory IgA, which is the stomach immune defense. And they found that the one who perceived the same stress as negative had lower immune defense in the stomach, the secretory IgA, where the people who perceived that same stress as not so stressful didn't have a reduction in their secretory IgA. And it's kind of like showing how the way that you relate to, there's a power that you have, and that's not to control stress, because stress is inevitable. I mean, you can have some influence over stress, but there's a power that people have that they often don't really spend a lot of time investigating and cultivating, which is how you relate to how you relate to stress. There are a lot of stresses that come as a surprise that you don't have a ton of control over, or if you did, you missed it and it's just here and you have to deal with it. And how can you relate to that stress in a way that's going to have the least negative impact, and maybe even come out on the other hand. And I was just listening to some people talking about instead of just post-traumatic stress, they were talking about post-traumatic growth too. And that with that the biggest indicator of post-traumatic growth involved having gone through some post-traumatic stress in order to get to that post-traumatic growth, but that there's this way of relating to that and reflecting on that stressful situation and circumstance in order to achieve growth as a result of even difficult and challenging situations.
I there's so much in what you just said. I love it. This is really where health is at. What's awesome is when you talk about post-traumatic growth, I in our meditation community, Meditation RX, we do these weekly themes, and I just did one on baggage. So for a week, my partner and I just talked about baggage, right? And one of the things I'm like, everybody seems to use this terminology, emotional baggage, and it immediately brings up this negative connotation. I'm like, people are like, oh, you fill up your backpack with all the negative stuff and then you carry it around. I'm like, well, why don't you just fill up the backpack with what you want, not with what you don't want? And I see people are like, Tom, you got over chronic Lyme disease, chronic babesiosis. You were sick for 13 and a half years. And just so you guys know, I've been better for over 11 without any symptoms. So you can do it too. And this is what really got me there. So I just decided what I wanted. And instead of focusing on all of that stuff, I started, I was always looking at being, like, do I go back outside? Well, like, I love being outside. This is what I do. It's in my soul. So yes, I go outside. I'm aware of the possibilities, and I'm aware if I'm in Utah or Colorado, I have a different risk, say, than if I'm in Connecticut. But I still go out in all these places because it's so important to me to do the things that that liven my soul and allow my heart to sing, because that's strengthens my immune system. So I'm aware, but I don't have post-traumatic stress disorder from getting Lyme. It's just like I grew and I learned and I understood that be careful. When my mom said it when I was a kid, in her originally meant, oh my God, don't die, but I think what she meant was, hey, Tom, like, be aware of the possibilities and take the appropriate action. And that's what I really love about our conversations, is that we're sitting here talking about ways to be aware of the possibilities, but then also not get stuck by them. And as you were talking, Miles, like, you reminded me of something, and I think I had mentioned this to you before. There's a functional MRI study where they took the 3 people and they're playing a remote video game, right? So they're throwing balls back and forth between these 3 people, back and forth, back and forth. And at one point, the researchers sent like a text message to 2 of the people, a little chat that said, hey, don't throw it to the other person. And so then they just kept playing for another few minutes and leaving the one person out. And then they whisked them all down the hallway to the functional MRI. And what you saw was the person who was left out, all the areas of their limbic system, which we all talk so much about in chronic illness, that have to do with negative emotion, processing of emotion, fear emotions, anger, they were all lit up. And then after the study, they told the person, they go, hey, you know what? This is actually just a simulation. Those 2 other people were actually just part of a computer program, and we just hit the button and it stopped playing with you. So one of the most important pieces about what you're talking about and the difference between post-traumatic stress and post-traumatic growth is that the way you view it, whether it's real or just perceived, because in this situation, that person was not traumatized directly. They were not, dissed or left out, but they thought they were, because there was no other human being. I mean, I guess you could say the person hit the button, but there was nobody else who was leaving them out except the program, and it totally changed their physiology. So whatever you think about, you truly do bring about. So that's where I think our approaches to healing and prevention of illness really are just so in line.
Yeah. Yeah. And I think there's even just within the context of even a diagnostic label like Lyme or babesiosis, that aspect of how do you relate to that diagnostic label? Like that in and of itself already has a lot of unpacking to do for some people, because some people do have externalized the locus of control onto the diagnostic label, and it becomes my Lyme is acting up today, and then I have no personal power anymore over that. But if it's the diagnostic label is held a little lighter, like, yes, this is contributing to how I'm feeling, absolutely, it probably is, and I'm going to hold lightly in the way that I relate to, and I'm going to hold with open curiosity to what extent is it, and to what extent am I in the way that I'm relating to it and to my body and to my energy and to my life. And how much is my attitude? How much is the way I'm relating to life playing a role in that? And it's not to say that what you're experiencing is created by you, not at all. Like, if you're experiencing something, then it's already there. Accept and embrace that and allow that to be as it is. But where you do have the power is how you relate to what you're feeling. So what you're feeling is what you're feeling. Like, don't try to push that away or resist that or say, why did I create that? I mean, I don't see that going anywhere productive, really. But how am I relating to how I'm feeling right now? How am I relating to the fatigue or the brain fog or the migrating joint pain or whatever is experience? How am I relating to my pain? To sit with that and to contemplate that deeply, how do I relate to my pain? can be immensely healing, more than a lot of people realize. And some people seek so much external. It's great. Do seek external stuff. Do seek treatment. Do seek medication and supplementation and peptides. Like, they can really help. They really can. And people undervalue and underappreciate so much of the time how much contemplating deeply how you relate to your pain can actually play a big role in the healing process.
It's so huge. It's so huge. And one of the things that I found was, like, I tell people a lot to, like, focus on what they want their life to look like. So, and you can start to bring that into your life now. But one of the parts I found was, I feel like I overcomplicated it. And what you were just saying, like, to me sounds like the most freeing thing I could possibly do, but also a daunting task, right? Because I have to, like, feel like I'm secure and safe in doing that. And one of the things I've learned is that, for me personally, I want to keep it simple, because I've studied all these things and I have all these practices, and it's just like, again, what's the one thing I'm going to do consistently? And one of the habits that I've gotten into that I really love and I want to share with everyone is, if you take, at the end of your day, like Miles is saying, hey, maybe I turn off the TV 2 hours or maybe 30 minutes or 3 minutes to start before I go to bed. What I'm finding is, I like to take 3 or 4 minutes, and it doesn't need to be any more. I sit down and I write the 3 wins I had for today. And on a day that everything went really well for me, that's usually a piece of cake. But on some of the other days, it's more like, where do I find the growth? Where do I find the lessons? But it doesn't matter how big or small. And it's just 3 things. And then this starts to bring me into this place of gratitude. It brings my nervous system down to a little more parasympathetic, and I can start to get ready for bed. And then I write down the 3 wins I'm going to have tomorrow. Because what I found was, one of the hardest things is, when I said what I'm worthy of and what I'm going to do and how I'm going to grow and how I'm going to heal and how I'm going to sit and experience my pain and learn something from it, my conscious mind is just like, F you, buddy. Like, you, for sure you are, right? Yeah, you're going to get, and your conscious mind starts to think a little bit too much more about what you're doing at times. And so then, but I realize I go to sleep. When I go to sleep, I don't think that much. I might have a dream. Sometimes you wake up thinking, but for the most part, you have a moment during the night when you're detached and you're separated from your conscious. And that's kind of like what allows your subconscious to become like super conscious, right? You are plugged into the universe, plugged into the divine, to the infinite possibilities, whatever you use to describe it. You can use whatever word is best for you, but you're plugged in, and you're less disconnected and more connected to source and life. And then you can get answers that you would never think of before with your conscious mind, because you're open. And so now I wake up the next day and I just read those 3 things from the day before, and I have gratitude. Wow, I had these cool wins yesterday. No judgment, whatever they are. Like, sometimes I'm like, I turned the TV off 2 minutes before I wanted to, right? I mean, it can be really a small win. And then you read those 3 that you're going to have for the day, and you start doing this every day. And you're like, at the end of a week, you're just like, holy shit, all this stuff is happening. And what I found is that the more I got a little bit, I focused on the little things, the more the big things came into my life. And then I'm able to sit more. But for me, I just overcomplicate things in the past. So now I try to simplify it, and I find I do it and it works really well. So what are some of the practices you do, aside from, like, maybe if you want to help somebody? Because one of the things I find with, if you feel traumatized, you're experiencing pain, dropping right fully into your body can be a bit of a shock, especially if you've sort of separated a little bit to protect yourself. So if you're introducing someone to something to help them heal, to help them start to be able to interact with that sensation within them, where might be a place to start that you might recommend?
Yeah, one of the things that I find really important as a principle for people to understand is the mind's always comparing stuff subconsciously. Like, you don't even have to consciously compare, and your mind will compare. If you see someone who looks like they have more energy than you, your mind is going to compare. If you're noticing their energy, your mind will subconsciously compare their energy to your energy, and you won't feel so great about your energy because you're kind of like thinking about their energy, and your mind by default is comparing subconsciously to your current situation. So my the principle that I think it's helpful to understand is that the mind has this default mode in which it's comparing to what you're thinking about to your current present situation. And if what you're thinking about is something that, oh, like I used to have so much more energy, that gets compared to your current situation. You feel bad about the fact that you have less energy right now. This in chronic disease gets really, really amplified, and people can get serious limbic system dysregulation because everything around them reminds them of the fact of that, oh, my friends are out partying and drinking and they seem to get up and okay, and I'm just dragging the whole day, and they seem to be working a lot and I'm not, and I used to be able to do this and now I'm not, and my partner is able to do this and I'm not. And it just can be overwhelming in the comparisons that are made subconsciously, and people can feel really bad about themselves, like really bad. And I've gotten into this too, where I've made these comparisons and gotten really down on myself in times when I was struggling deeply with chronic fatigue, where I really was wondering if I was cut out to be even going through medical education and working towards being able to work with patients. And I
Right.
questioned my dreams. And yeah, it's really sad when I see people who are having that happen. And so a very simple practice that I recommend to people is to make a new comparison consciously when you're feeling like you're feeling down, to consciously make a new comparison. So if you notice in your body, like I'm feeling a little constricted, I'm feeling a little heavy, I'm feeling a little depressed, like anything like that, to make a new comparison to whatever it is that you were thinking about in that moment. And the very simple frame for this that I like to give people is, even though blank, I am so grateful that blank. So even though I'm feeling down right now, I'm so grateful that I do have a loving family member with me. Even though my energy isn't as much as I'd like it to be or as much as it used to be, I'm glad. I'm so grateful that I'm not bedridden, hospital bound, and completely unable to get out of bed. Even though my emotions aren't where I'd like them to be and I'm feeling really anxious right now, I am grateful that I have the capacity to be aware of my emotions and put a little space around them. And so just those little reframes and recomparisons, even though blank, I'm so grateful that blank, when you're feeling a little off, or even just preventively throughout the day if you want to, but just doing that on the fly as you're feeling a little bit like your nervous system is amplified or on edge, that tool I find can be really helpful in starting to retrain the limbic system in the brain to bring it down a notch. It brings it down just a notch at a time. And it's a step-by-step. It's a small thing, but again, it's a habit that if you build it, it can make a huge difference in the limbic activation.
Yeah. And I mean, I think it's so critical, Miles, the way you just described it, because it's a small habit. And the way I heard you saying, it's almost like I can feel myself doing this multiple times in a day, right? It becomes like your healing mantra. And I think what's so important for folks to experience and understand is that all these limbic retraining things that everybody that are all the rave, all they're doing is they're giving you a format to do what you can do on your own on a regular basis. And some are structured in certain ways that get you grounded, but it's like, the bottom line is I've known of no one that limbic retraining works for if they don't do it. It just doesn't happen, right? However, one of the things I do know, and I would say that everybody I know does limbic retraining one way or the other. And the choice, but the question is, going back to like the baggage is, are you doing negative limbic training or are you doing positive limbic training? And what you just did was a nice segue from, hey, this is the way I'm thinking, and I'm not going to say it's not there. I am acknowledging that this is the reality of my life. And I'm also choosing to interact with it in this other way. And that was like my little tools. Like, I just want to go, hey, my day was maybe had a lot of things I didn't like in it, but I could just find a few small things that were awesome. And you know what? I'm going to plan to have more small, awesome things happen in my life. Like, like I have people literally, they're just like, I'm going to be able to walk to the bathroom from my bed and back without assistance. The bathroom happens to be 6 feet from my bed. Hey, you know what? To me, I just went on a bike ride today, right? But I remember talking to Terry Walls, who's just like, look, I was in a wheelchair, tilt recline wheelchair. Now she can go on a bike ride. But she didn't just go, oh, like I'm perfectly healthy, I'm on a bike ride today, when she was in a wheelchair, because your brain is like, yeah, F you, you
Yeah.
know, but there's that progression with that goal. And that's what I really love about the reframe. And you could do it over and over and over. So, just beautiful. I love it. One of the things I did want to make sure we touch on, because, there's different ways people experience this. And we like to say, hey, let's think about this and reframe it. Let's just write it down. Let's make a prep. What about just breathing? Because I heard you say that at the top of our chat. I know we both are big into certain types of breathing. Some of them are very, very similar. So
yeah,
love to have you riff on that a little bit.
Yeah, I mean, breath is one of those interesting parts of the autonomic nervous system that you can control. I mean, it's not like you can say heart slow down or speed up. I mean, but you can tell your breath to do that, and you can actually consciously control it. Almost everyone can just consciously control their breath by default. And so when we're trying to get an entry point into the autonomic nervous system, which is regulating blood flow, regulating heart rate, regulating so much of our physiology, that if you adjust one part of it, other parts can respond, and including inflammation, including things that are really important targets of working with chronic health. And if you're dealing with inflammation, and if you could change your breathing and change your inflammatory state, or if you could change your breathing and change which aspect of the nervous system is activated, these are things that can absolutely positively be applied into healing or prevention, both. And I see it all the time as being so helpful to gain some degree of conscious control over the autonomic nervous system. You don't want to have to manage all the autonomic nervous system stuff consciously all the time. You go crazy, but you want to be able to influence it and impact it consciously if you're trying to recover or optimize or prevent.
Yeah, it's so interesting, because I remember so many people in our field talk about heart rate variability. The biohackers are talking about heart rate variability, and our heart rate variability is such a key indicator of our real age, if you will, like our sort of our health age rather than our chronologic age, our resilience, to stress, our immune strength, and just our often very, very much our overall level of happiness and joy. And one of in the research is, so we hear a lot about the vagus nerve and all the exercises to do with the neck and all these other things to loosen up the vagus and polyvagal theory. But the vagus nerve, part of it goes down to our gut and provides a lot of the nervous control, both downward and upward, like to and from our gut, in a way that allows us to, have our immune system functioning optimally, experience that gut reaction. And if our gut is off, feeds back to our brain in ways that can actually inhibit our ability to have good memories and can change our mood. But the part that goes to the heart, when you look at Lyme disease, there's actually research that shows that Lyme can negatively impact the vagus nerve itself, or the brainstem, and the brainstem areas where the vagus nerve comes out of the brain. And we can change the cardiac, the ability of breathing to help you control your heart rate, and directly the vagus nerve affecting your heart rate. So whenever I talk to folks, I'm like, when a simple breath awareness practice, or anything that allows you to be aware that you're breathing, and you start to come into your body with it, actually, you can do it with biofeedback devices and rings and watches to see you're doing it right. But as long as you can start to feel that, and it brings you just a little calmer, we know that is helping to counteract what Lyme disease may be negatively doing to your vagus. And we see so many people with rapid heart rate, POTS, orthostatic low blood pressure. So meaning you change position, you get dizzy or lightheaded, you may even pass out. And Lyme can trigger that. Babesia can trigger that. One of the easiest ways to start to change it, and again, to Miles's point earlier, you do these things, plus you see your practitioner to learn what other treatments you might need. But we're giving you the tools to supercharge your baseline health, to supercharge your preventive health, and to supercharge your healing from any chronic thing you have. And it's not just, oh, this sounds good and we read it in a book, or we like to meditate, so we want to share it with you. Literally, there's evidence that Lyme screws this shit up, and you can fix it by breathing. I mean, literally, you can take back control over Lyme disease. And for some people, it's a little, and for some people, it's a lot, just by focusing on your breathing as one example. So always working with your practitioner, but realize like limbic retraining and all these heart rate variability, you're actually in control of it by one, doing it, and two, knowing that you're breathing and alive.
And breath work is so vast. I mean, there are so many breath practices and they do very different things too. I mean, there's the whole spectrum there's one study called voluntary activation of the sympathetic nervous system and attenuation of the innate immune response in humans. It's a really interesting study that looked at a breath technique specifically intended to activate the sympathetic nervous system, which you'd think, why would you want to activate the sympathetic nervous system intentionally? But this study found that with this intentional voluntary activation of the sympathetic nervous system, these people were able to completely eliminate the symptoms of being injected with endotoxin. Like they literally took that E. coli bacteria, which have LPS or lipopolysaccharide, which is an endotoxin, and injected it straight into the bloodstream. They've done this on thousands of people. Everyone gets sick. They feel miserable for like 3 hours. They want to vomit. They're all nauseous. They're headachy and they're feeling bad until this stuff clears their system. But these people, they did this breathing where they activated the sympathetic part of the nervous system when they were getting injected with this stuff. And they literally had this crazy increase in adrenaline and a significant decrease in all the inflammatory markers that endotoxin would normally have. When they look at controls, they had all these inflammatory markers, TNF alpha and interleukin 2, interleukin 6 were elevated. In these people who did this breathing, they were way lower inflammatory markers. And the anti-inflammatory marker IL-10 was way higher in the people who are doing this breathing. And even cortisol, which can be associated with more of that chronic stress side, that was lower or the same. So it wasn't increasing cortisol at all, but it was increasing adrenaline voluntarily, reducing inflammation. And this is really interesting for especially people who are exposed to mold toxins or Lyme toxins. It really interests me in to what degree can this kind of breathing play a role. And I utilize this breathing in my practice, but it's a mixed bag. Some people aren't ready for it, and it's a little too much because you are activating the sympathetic, which, you know, if the sympathetic is already too active, that you have to be careful. But sometimes what's interesting is when the sympathetic is too active, if you activate it a little more, then it can come down again. And that's kind of interesting too. And we sometimes find that helps people relax.
Yeah, it's like, I feel like there's this one size fits all. It's like, what's the best way to detoxify my brain? I'm like, well, you can take all these supplements, but if your structure's off or your sleep is off, it might not work. It depends. What do I need? And we talk so much about chronic inflammation. We're getting stuck in a Th1 response. It's acute inflammatory response. Well, a lot of people just try to like balance it. I'm like, well, sometimes it needs to be out of balance, so you have to finish it. So maybe, like you just said, is we bump it up a little bit more and then allow it to come back down because it's been allowed to finish its cycle. Because maybe we started at a place where we weren't able to get, we're almost there. It's like we're at the top of the mountain. We got one more hand to go. We need somebody to give us a little boost. And some people need to go the complete opposite way. And most of the time, I find that everyone needs to do, well, many people need to do all parts of what we were just talking about, but it depends on what, so it's not just knowing what to do, but it's knowing what order to do it in. And so going back to what you said about comparisons, I see so many people compare themselves to someone else's treatment protocol. Please just remember that it is someone else's treatment protocol. Now you can learn and glean something potentially from that, but it's not your treatment protocol, right? And, you know, and that's the thing I think is so important, to leaving the comparison out, learning. And it goes back to my comment about be careful. Like my mom literally was like, Tom, when you go across the street, don't die because my life will be over. Like if it'll be my fault, even though I wasn't there. I didn't teach you well enough. I didn't like, whatever, lock you in a cave somewhere. And I was like, but I know that what she meant, that was part of it. But the other part is just be aware of what's going on. Be aware of the treatment approaches out there. Be aware of the preventive approaches. But be aware, and I kid you not, a minimum of 70% of my improvement after 8 years of chronic illness was me taking action for myself. I got stuck around 75% improvement. And then I created in my journey the opportunity to say yes to going to the office of the doctors that turned out to see people like me. They were able to help me finish that little bit. But I mean, think about it. Like, how many times do you read, you can't get better? Oh, it goes into remission. I'm like, guys, you can all get fully better and go back to life the way you want. In fact, to Miles, your point about like almost like post-traumatic growth, I mean, yes, I learned a lot. I feel better. Like, I would have liked to have those 13 years probably back on my side, but I'm a different person. And I feel like my brain was amazing beforehand. It got shitty as hell. At one point, I couldn't do 2 times 3 in my head. That's pretty pathetic when you're in your early 20s and you're starting medical school. It's pretty bad.
Yeah.
Now it's just like, boom, it's better than ever, right? And so you can learn from this, and it can actually catapult you to levels that you never even knew that you had within you. So, and the bottom line is, if you're pissed off about where you're at, that's one way to waste a lot of energy. Being aware of where you're at, understanding you would prefer to be somewhere else, and putting your energy into getting to that place is certainly good. But I mean, if you're fighting reality, it's just like, hey, I talked to a couple of people earlier today and they're just like, I'm a little off today and I'm tired. I'm like, cool. Then just be respectful of that. Because I know over the weekend, this one particular person who was telling me they're tired, they did a bunch of gardening and they were setting some stuff up. So they kind of exerted, and they need we have seasons in the world. We have seasons in our own health.
Yeah, and with the same person, even at different times, it's not just what's right for me. It's also what's right for me now might not be what's right for me tomorrow. And there are seasons within one life. There's each individual being different, and people are looking for the cure-all and the smoking gun. And so many times people come in saying, well, what's the one root cause?
What is your number one Lyme
smoking
treatment
cause, and the one treatment? And I get really nervous when people come in and they say, oh, I talked to this other practitioner and they said, oh, it's this new treatment, and it just takes care of Lyme immediately. People say that, and it's like, okay, well, you try it if you feel like you want to try it. And I from my experience, I haven't seen things like that. I've seen this to be a very by individual kind of experience that I tell people I'm probably not going to get it right on the first try. Like, we're going to put together a protocol. We're going to run a bunch of labs. We're going to find usually 3, 4, 5 things going on. It's probably not just Lyme. It's probably also gut imbalance, methylation, an issue. There's probably maybe some autoimmunity, some other things that, they boil back to similar root causes, but there's going to be, even on the root cause level, multiple, usually 3, 4 that we're going to have to deal with. And even within dealing with those and going through that treatment process, my guess is that even if I've identified 4 clear root causes and we've decided these 2 are the primary 2 to start our treatment, our first phase of treatment with, I tell people, like, we may get it right on the first try, and usually we're going to have to tweak it, hone it, refine it, change the dose a little bit. We might have to layer something on top. We might have to subtract something out. We might retest and find that it's part way better, but not all the way better. We might retest and find that it's not better at all, and we've missed the boat. And usually that doesn't happen, but it can. And it's a process, and it changes not only on the individual level, but on the timing, on how your body is. And I don't want to make it sound too complicated, because we can take all the information and put together a plan, that's step-by-step plan, and help people walk through it without it being excessively complicated. But it is very individual, very much an individual thing that does involve direct communication, tweaking, honing, refining the protocol, doing some retesting. It's like a dance. Right. And it's a fun dance. It's a dance. I mean, you and I were both experienced. We know how to do that dance. So it's not a huge stress to do. It's a step-by-step thing. It could be overwhelming if you don't understand it at first, but it's fun. It's nice. We know, like, we can do it in our sleep at this point probably, but it's it's a moving, changing, dynamic thing.
Well, I think that's the thing. I tell people that, like, so much what you were saying is so true. It's like, and I just want to let, there is a question in the chat, which I'll make sure we get to in just a minute. I just wanted to make sure that the person asking it is aware that we're coming for you, because I'm so excited. It's a great question. And this will dovetail pretty nicely. I mean, one of the things for me is, like, and you said it so well, this is so complicated. And when you Google shop and YouTube shop, and when you read everybody's protocol in their book and shop, there's a lot of complexity. But I've literally, my entire professional career, this is the only thing I've done, is work that dance. And I love it, and I don't love that you're sick, but like Miles, like you were saying, it's like, we love the fact that we have a structure, so to me, I used to think that I was just always freestyling. But really what happens is I love a structure and a super strong foundation of knowledge and experience and options. And then they're all in my tool belt, and I sit down with you and I take that tool belt and I drop it on the floor, so that I can, now when you tell me something, I can reach, and I've got every tool under the sun, and some you probably never even heard of. But what I want to do is I want to listen to what you're telling me with words, what you're telling me with your energy and with your body language. I want to listen to what I'm getting as a human being sitting here with you, right? And being a part of this together. And then I want to figure out what tool I pick up today for you. And like, there is this background of, like, yes, methylation is important, gut health is important, sleep is important. We're giving you some of the tools that you can work on at home that are the baseline of just general health and enjoyment of life, because all of those things will supercharge your immune system. And then you're uplifting yourself so that anything you do with one of us works better, right? So that your investment in your own health, whether it's time, money, crap you put into your mouth and swallow, because so many of us take so many supplements, we want them all to work optimally. Right. And if my stress level and my lack of sleep leads to so much inflammation, I can't absorb out of my gut. And it's not that I have a damn parasite, it's that I don't go to bed. And when I go to bed, I'm stressed out. So I'm really not sleeping well. My inflammation through the ceiling. As examples, like, these are ways that kind of, block all that stuff, and it's like, I'm just so driven to share the fact that you have more control than the modern medical system seems to want to let you in on. It's like, we like to take it away. So talking about control, one of the questions, and I'd love to hear your thoughts on this, Miles, is what are your thoughts on EFT as another type of practice you could do at home?
Yeah, well, I'm guessing you're talking about tapping,
Yeah.
because there's another form of EFT for relationship counseling called emotionally focused therapy, which is great also.
I'm gonna take a wild stab at this, that we're talking about EFT tapping, emotional freedom technique, but
yeah. So emotional
please
freedom.
Please correct us if we're wrong now, because we're happy to talk about that topic as well.
Yeah, so emotional freedom technique tapping is a useful tool. Again, one of the tools in the tool belt. It's a way that you can, in a sense, you're distracting the conscious mind a little bit with tapping, so that you can put in a new belief, put in a new sense about something, and it can help you with desensitizing an emotional response. Like I was talking about the even though blank, I'm so grateful that blank. It's similar when you're thinking about a stressful situation and you're doing tapping around it, then you might even say something like, I deeply love and accept myself. And you give us an affirmation as you're tapping to kind of distract the conscious mind a little bit, so that it can go in and you can accept and embrace it a little easier without those conscious defenses being like, well, but I did this situation and that. And so the conscious mind has a little less fight to it when you're tapping, which is pretty interesting.
It is. And I mean, it's kind of, I'm thinking of all these little real world examples. Like if you can't get reflexes on people, you're hitting their knee, it's not going, you know, they're not all messed up. A lot of people are so you have them pulling their hands, or you ask them, somebody over there asks them a question, boom, and it's like that conscious protective mechanism shuts off for just a second, and what you want to do can get put in, and it's like when you're trying to get someone even to like learn to ride a bike, a lot of times like we'll do little tricks that distract people or put their tongue in a different place. Now, granted, there's neurologic loops, but it's just anything that changes your brain gets you. And then, so one of the things I find really interesting is that with the way the brain works is the way that subconscious thought patterns really get impressed upon our subconscious mind, or sort of get written in, how we do a system reboot, if you will. We upgrade to a new operating system. Whether that one has a lot of bugs or not, it's a different story. But the way we upgrade is usually through a very powerful emotional experience, one. And most powerful emotional experiences tend to be negative. They don't have to be, but we have pandemics, we have 9/11s, we have wars, like big things. Someone dies unexpectedly. Or we get a chronic illness and we feel like our life is leaving us and we don't have that. It's like, this is a thing. Then on the other side, the way we reprogram ourselves is repetition. So, and a lot of that repetition needs to have emotion behind it. So when you're looking at EFT, when you're looking at the breathing, the gratitude practices, the reframing that Miles shared with you, they are all practices that shift the way you're thinking, distract you a little bit from, your typical mind thought, but it's repetition. So now if we step back for a second, we say, why am I so fucked by chronic illness? And why can't I get out of my own way, even though I really, really want to? We've got a major emotional experience that's big. And it's also a major emotional experience that's big, that's repetitive. So you got both sides, and that's why we're giving you different tools that allow you to get in for you today. Because like Miles is saying, maybe tomorrow you need some other tool. Today, meditation was easy. Tomorrow, the only thing I can do is kind of do this and go, I'm feeling freaking great today.
Yeah. And there's another thing, which is that the mind produces stuff in response to the thoughts and the situations. And like if you ask a question, you're likely to get an answer. Your mind is good at producing an answer. And if you ask, why am I so messed up? Why am I so tired? Your mind will tell you lots of reasons why, right? But if you ask different questions, like sometimes I think like one thing that really can help people in some cases is start to ask different questions. Like if I ask, how can I begin to learn to feel better? How can I begin to make small changes in my life towards health?
Right. Dude, it's fun when even just the way guys, I'm going to have you say that again in a second, Miles, because even though I was like reading a question in the chat to make sure I had that, and I kind of was following where you're going, the way the question is phrased just made me kind of, my head, that's why I go like this. And this is what you want. You want to change that habitual pattern and you switch it up in your brain. That's like what tapping is doing, right? And a lot of these other practices, it switches what we're expecting. So it's like a pattern interrupt that allows you to then put in a new program that you want. So could you just run through that one more time?
So a question like, how can I begin to learn to feel better?
What does that's so great, NLP there. How can I begin to learn to feel better? I mean, it's like, because usually it's, how can I begin to feel better? Or how can I learn to feel better? But how can I begin to learn to feel better? You almost have to stop and your brain's like, what?
Yeah, and there's a lot of presuppositions in there. You're presupposing that you can learn to feel better, like feeling better is a learning. Like you're already presupposing that feeling better is something that can be learned, and that is a process that can be begun here now. And so, little things like directing the mind with questions towards an outcome that you're interested in achieving is really interesting. Or, like if you want to ask negatively directed questions, then can you ask negatively directed questions about your limitations, right? like if you want to learn to Like if you want to feel bad about something, feel bad about your limitations and start to learn to instead work on the things that you can do, and to forget the problem. You don't want to completely forget your problems, but you might want to think a little less about them, right? So even learning to forget, how can I forget what isn't important about what's bothering me, and start to remember what's important about the things that I really love and care about in my life. And these kinds of things are really interesting to think about, and can make a real big difference for people if they contemplate them deeply.
Nice. I love it. What a great conversation. I wanted to kind of hit it. We've been having this amazing chat about all our mindfulness stuff. And there is a very medical question, but I think I want to hit that as we kind of wrap things up, because I'm so thankful everyone's been with us for this entire time. And Miles, so thankful for your time. And there's a question about, can we take 8-year-old doxycycline? Because they're, and it's interesting. Most medications are good way, way, way beyond their expiration date. There is a debate in the tetracycline group whether or not they will sort of break down into certain things that become toxic to your kidneys in particular after a certain date. And you can find pharmacists that say, yes, you should never use expired stuff. There was an older FDA publication on using doxy for anthrax, and they're like 13 months to 133 months after expiration might be okay. But that I read that a while back, and then when I went back to look at it a while ago, it's no longer up. So the thing is, like, most meds are going to be all right for a couple of years. Tetracyclines are a little bit questionable. So again, our goal is never to take expired stuff without someone supervising us. That one in particular, there's a little bit of a question, because also, like, a lot of times if the FDA stockpiles expired drugs, they're storing them in a way that we are not storing them. So, once you get beyond a certain point of which we're not 100% sure where it is, it might be not a good idea. So when in doubt, don't take expired meds or meds that aren't prescribed by somebody, as a general rule.
Yep, that's a good general rule.
And there's always exceptions to every general rule that, but that particular class is a little bit more of a concern about. So, especially when you're talking 8 years or more. So, Miles, I mean, what an amazing chat. I'm so thankful that we're able to get some time to do this and share with people that, like, our best prevention tips are our best longevity tips, are our best happiness tips, and our best recover from chronic illness tips. So, is there anything that you want to leave everybody with as we kind of close out here?
Yeah, I mean, you alluded to it earlier with your own personal story, but there's hope. I've personally struggled also with multiple chronic infections and mold illness and gut issues and autoimmune, and we didn't really talk a whole lot about autoimmunity and Lyme's root cause for autoimmunity, but things like fibromyalgia, autoimmunity, anxiety, depression, OCD, other aspects that are sometimes relegated just to the mental emotional realm. Right now, I'm kind of personally on a mission to try to help educate people a little more about mental health and the relationship between mental health and infections like Lyme and Bartonella, and also mold and mold toxin illness and Epstein-Barr virus. And that if especially you've had a situation where you started to have mental health concerns that are not clearly and obviously related to a specific emotional trauma, it may be infection related, and even if there is an emotional trauma there, infection could be playing a role in brain chemistry. We see an underlying mechanism of there being brain receptor sites attacked through infections, an autoimmune cross-reactivity with certain infections, and we see sometimes some autoimmune issues, things like rheumatoid arthritis and many others that are in the autoimmune class and category being related often to infection. So I'd like to instill a little hope in people that if you have something that people say, oh, there's nothing you can do about it, you just have to live with it or deal with it, question that, even if they're an authority, even if they're top in their field. When people give you limitations, then I mean, some of them might be real, but I recommend you question them in respect to things like especially autoimmune issues and mental health issues. There may be underlying root causes. There may be hope to work out some things that could help you to feel dramatically better.
Yeah, I totally agree. It's so important to share that hope that, I mean, I feel like our system has stopped questioning things. And when they question things, it's usually, why aren't you doing what we demanded or told you to do? And so I think that's just so well said. So, and what I want to do is make sure that we give you a chance to let people know where they can find out more information about you. And I'll certainly be putting in the notes once the live is done. I'll just go in and drop it for anybody who watches in the future. But where can folks find out more about your work, Miles?
Yeah, my clinic is called Medicine with Heart, and that's medicinewithheart.com. It's based in Colorado in the greater Denver area, kind of west suburb of Denver called Lakewood, but we do work with people across the US. So people can get in contact with our clinic through medicinewithheart.com is the best way. You can find on social Medicine with Heart as well. So there are a few different facebook.com/medicinewithheart and Instagram as well. But the website's the best way. We have a blog on there, free blog, and way to schedule a call with the staff on our clinic. So that's probably the best way to get some additional information.
Yeah. And I mean, I know that you guys have some good articles on peptides and stuff, things that we talked about, but we didn't get to jump into because, when we have time together, we focus on the biggest bang for your buck, the most important things, the things that are really going to move the needle for you and that you can use to move the needle for you, because most of those other things, you're going to need a skilled provider with you. But I just want everyone to really remember, like 75% of my healing, if not more, was done without the aid of someone else because I didn't have anyone. And I just would not give up on myself. And now you have so much more, many more providers who are skilled or training. Both Miles and I do practitioner training programs in our own unique styles in order to help you have more access to people who are skilled at, figuring out, being open to the possibility. And also people who are willing to say, this isn't Lyme, it's some other thing, like Miles was saying, and it can be multiple things. So we're really, really excited to be able to give you that information. So have a great, great rest of your day. Enjoy the rest of Lyme Awareness Month. And I'm just so blessed that you guys are all here with us. And Dr. Miles Nichols, thanks for joining us as well.
Yeah, Dr. Tom, thank you for your time and for putting this together. And thanks everyone for watching.